Good morning, everybody. For last 3 days, we have been hearing about artificial intelligence. Today, we are going to talk about human being. We are coming back to the original, the need of human being in healthcare system. Do you think that artificial intelligence is going to replace human being? No. Did smartphone made us any less smarter? So artificial intelligence is ultimately going to be used by human being itself for bettering their performance. So we have got elite panelists who are going to take you through the different challenges that they face in different regions, from the retention and recruitment to retention of human being. So I would like to start with Dr. Kurdi.
Thank you very much.
Who will enlighten about the challenges he's facing in the GCC region. Am I correct?
Yes, sure. Thank you very much. Good morning, everybody. It's really a very interesting topic because it's a challenge that we face every day. In the Gulf region, in the Gulf countries, we really face a huge deficiencies of health workers. And in particular, when it comes to technical workers like nursing and allied health services. And the most challenging thing is finding the right people with the right mindset and keeping them, returning them. In a very short survey that done by the Ministry of Health in Saudi Arabia, 65% of the MOH hospitals, they actually have shortage of staff, of qualified staff. This is MOH hospital where actually the government has the fund, has the money. It's not like private sector. So I would imagine the private sector actually has more deficiencies than the Ministry of Health hospitals. The other thing is our turnaround or turnover staff is more than 25% of the staff leave the hospitals within the first year. And that's really a significantly high number as well, because if you look at how long you need to train a staff to be fit within your institution, policy, procedures, understand the work, it usually takes around 6 months before they're really fully trained. And that's based on statistics that you need 6 months to get them to be really within that system. And then after that, in 6 months' time, 25% will leave you, and you have already a shortage. So it's really a big challenge that we're facing. The percentage of Saudi nurses, for example, in Saudi Arabia, is quite low. And that makes us dependent on mainly East Asia nurses, because we cannot live without Indian and Filipino nurses, honestly, because this is the way to go. We have a stronger program. We have a lot of governmental initiative to encourage businessmen to open and develop nursing schools. And really, it does not make sense that we don't have enough nurses till now, but we're really working hard in building more nursing schools. So I don't want to take the time, but it's a long topic, and if we keep talking, we'll talk till.
But after you have identified and recruited the right kind of technical staff, what do you do differently to retain them?
Absolutely. I think number one is training.
Okay.
And give them a clear career path where you show them that this is where you are here today, this is where you want to go, and this is your career path, so we are going to help you and train you. So they feel supported, which is number one. And number two, of course, is try to give them a comparable pay as the market, and they should not feel that they're underpaid. And the third, which is very important, is creating the right environment for them to stay. For us to bring somebody from her or his own country and his own culture. We have to create a similar culture or a similar place for them to live. So we actually give them to live in compound, we create accommodation, we provide them with transportation. That's all translate into a higher cost. And that's all translate into more pressure on us as managers who actually sit with our finance guys and say, oh, well, what are you doing? You're spending more money than what you should. So it's really put pressure where you need to find that equation between retaining these people, provide them with the training and courses, give them the suitable pay, and then let them live in an environment where they feel comfortable, and when they walk into the hospital, they walk in happy, comfortable, they can serve the people with a nice smile.
Thank you very much. Joern, you are operating on the same thing in Germany and Europe. So what are the different challenges you have been facing in that particular region? And I hope it will be a little bit different from what challenges he faces at GCC.
Sure. I think we experience all kind of same things, same questions. I'm one of the co-founders of the biggest dental chain of dental clinics in Germany with more than 3,000 employees right now. And what we see is most of the young dentists are female. Right now, about 80% leaving the university are female. We have some courses with 100% females, and most of them want to get later kids, want a family, whatever, and almost nobody wants to make their own clinic anymore. In former times, everybody was an entrepreneur and founded a small practice, small clinic, but right now, for legal reasons, they are working about 40% non-medical, just administrative work and whatever, and it's getting more and more. And then it costs a lot of money. In Germany, you need more than, let's say, €1 million or more for an average small clinic to build it, to buy it. And in the future, we have the only chance to get them to work, that they can work in a bigger group. And we do all the administrative work. We have the clinics, we have bigger clinics, we have different specialties in our clinics, and that's the only way that they can work. And we see the same, not only with females, but even the male dentists are searching for work-life balance, and they are no longer only, let's say, success-driven, money-driven, whatever. They say, okay, money needs to be there, but not that much. We have to have our free time with the family, quality time, whatever. And so we have to give them the opportunity to work like this. The second problem we have, there are a lot of dental nurses, and all of them female that we had for this nurses work now want to be, let's say, influencer or nail designer or whatever, but not longer standing at the chair side to help the dentist. It's not longer an attractive profession for them. So we have to change this occupation to be a little bit more attractive for them, what means they have to grow up in their profession. They need different positions, different kind of work, whatever. It's a long way what we have to do. Otherwise, we will have a lack of dental clinics, especially in the countryside. So we are just in the beginning of our work.
Thank you so much. Very interesting. Kenny, can you just take us through what challenges you face in Asia? Because you are from that side, you're from Malaysia, and so is it anything different or very similar, and how do you tackle this?
Thanks, Mr. Prashun. Appreciate the opportunity to be here. I think I heard from all the panelists, we have difficulties in environment, we have difficulties in gender, change in culture, perspective, the millennials, generation difference. So I'm going to give a bit of introduction about our background in Southeast Asia. I'm Dr. Kenny Yeap. I'm actually a Chinese descendant that stays in Malaysia, a Muslim country. We are currently, I'm actually in Borneo Island, which is the eastern part of Malaysia. It's actually an island, consists of 3 countries, Malaysia, Brunei, and Indonesia. So I'm working in Borneo Medical Center, MIRI, which is the largest chain of medical center, private medical center in our state. And we have a lot of challenges that we are being facing. I think the main challenges in healthcare is actually the retention of manpower, especially after COVID. COVID actually brings up a lot of revolutions in terms of mindset, in terms of security. So I'm just going to share a bit what we have done for the past 3 years at our medical center in the local setting. So this is what we have in the conventional organization. We call it a vertical structure organization. It's going to be top-up or bottom-up. So the relationship is always, the boss is always right. The boss says what, the policy owner says what. We have the authorization, we follows. It's very important to have this kind of organization, especially in healthcare, because you need to regulate it so that you have the quality in terms of delivery towards your patients. So what happened during COVID is that you have all these pictures coming out. I believe it's not just in Southeast Asia, it's a whole global impact. It's a pandemic. You have patients, because I'm a doctor myself, I also need to go down to practice. During this period, you can see a lot of first photos pictures that patients are intubated with a lot of level 4 PPEs, on respirators, long hours, more than 12 hours because of the manpower not enough. You'll be suffocating. The most important is you'll be in this kind of photos after your finish of your shift. You'll be thinking, am I going to be the next person to pass away like my colleagues did? The doctor that passed away because of COVID-19. We actually have a handful of doctors because of COVID-19 pass away, and these are leaders among the industries. And this is not just in Malaysia, I think it's in the whole world, because we are facing an unknown. So we go through massive vaccination period, the stress level to massively chase so that we can have herd immunity. You can see all the chairs, and me dealing with my local ministers, very concerned regarding the progress of our private participation, and also the local health ministers in early morning at 5 to 6 a.m. need to go down to earth to talk to our local junior doctors, the housemen, on what are the stress level they are facing because of COVID-19. A lot of people are striking, a lot of people are feeling the stress level, the requirement for them to work extra miles beyond their job description. This is a professional that the hazard is so high that this, if we do not touch and take care of it, a lot of people will just leave to find a better sense of belonging. So what happened during the cycle of frustration is, it's going to be very stressful in brain. They reduce their creativity, they just give up. They do not want to innovate and find solution. You reduce productivity. By the end of the day, when every frustrated employee continue to have, they are going to get away from your organization because they feel that you do not care for them. Human is very simple. People just do not care how much you know, how big your organization. They just care how much you care about them. If you care about your organization, somehow they will stay. So what 3 key strategic development that we do in human power retention in my organization is, the first one, I restructured the relationship, the reward system, and the system that governs the reporting line between the stakeholders. So the red color is actually our doctors. So our doctors went through a customer service mindset training where they do not become just the leader of governance. They actually respect and understand that the allied healthcare and the nurses are also your customer. At the same time, the nurses understand that the doctors are their customers because we practice in a partnership relationship, meaning that we serve them in a way that we want to give hospitality towards the doctors. It's not just reporting towards them. So this mindset training is the first step that we do in terms of restructuring of relationship. And we create a community among the middle organization. Because in middle organization, they face a lot of difficulties in which they need to carry out instruction. At the same time, they need to be a leader among the ground level of frontliners. So this community, what we do is we actually created a mastermind groups. We transfer them, we break boundaries, and we let in between departments form a community so that they can able to communicate among each other and come up with solution much faster before it goes up to my side. If you see, I'm actually in between all of them, and I'm the main coordinators. If I require to coordinate everything at the same time during COVID period, it's going to be very challenging. Because a lot of time when things happen, you can actually solve it at the point of care. It doesn't require to go up until the level of the upper or highest management level. So once we created this relationship, we empower them with a reward system. So what reward system we empower is we actually created not just an employment relationship. In Malaysia, we are very fortunate, we have a fund called Human Resource Development Fund, where it's regulated that every organization with employee, you are required to pay 1% of basic salary towards these central federal funds. And these central federal funds can be tapped in terms of training purpose. So what we did is we actually convert this community of middle class management or senior management group to a trainer, independent trainer, where they do not just receive salary and dependent on the stakeholders on top of you on performance review to get their income. They become a partner with us. I give you an example where what happened is during this training, we actually converted them into trainers that they actually can present or provide training such as basic life support. They provide training such as stress management, infection controls. All of this training, not just providing to our side, but also outside organization, where they can actually tap into this fund. In one day, they can actually tap up to around 5,000 AED. That's how much income that they can tap from this fund. And we give them the opportunity, we train them to have this exposure and to be able to become the partner, not just the employee of our organization. With that, we can able to retain talent that are more senior. So these are the main restructuring steps one that we do. The part two that we do, actually we introduce a communication and developmental review. We actually develop them to have a mastermind group. Our senior employee will sit down and actually have a monthly or 2 monthly session with a coach that will help them to build up the gap in terms of skills that they required and talk about what are the challenges they face in ground level. And individual of them will actually speak and talk about how they are going to solve and to go through the challenges. So even we'll do some activities to make them triggers and release their minds and reduce their stress. And third of all is what being mentioned is actually culturally relevant. Even saying that our organization is still a local organization, but we have a lot of different culture background when they come to our organization. But by the end of the day, when you want to have a performance-driven organization, you require to develop culture value. And that culture value depends on the core value that the top organization decides and disseminate. So no matter whether you are at the very bottom 40 group of organization, where you are poor, you have a different education background, or you are at educator level or a tertiary education level, you require at the basic level to uphold the core value in that organization for any appraisal or any developmental review in order for us to progress. That is our principle. So we developed this principle called trust. Core value where you practice in trustworthiness, respect, unity, safety for your patients, and timeliness in response. So no matter what we do in our organization, when we do appraisal, we practice and emphasize on all this core value. It can be our core value, it can be your own core value, but core value is very important as a basic component for us to develop transformative changes. And from this, we develop team buildings to cultivate the core value and to increase the idea on how much important that we look into the value and a sense of belonging for the family that whoever joins us, no matter you are at top level talent or you're at the frontliners. So these are how happy they are. And all these three are all the basic, simple, transformative changes to give a sense of belonging for my organization. So do connect with me on LinkedIn. I would like to share my ideas and look forward for any potential collaboration and any ideas to retention of manpower.
Thank you very much, Dr. Kenny.
Thank you, Mr. Prashun.
In India also, we face a very similar kind of problems that you have discussed in terms of getting the right kind of people as well as retaining them throughout the journey of the business. But most important challenge that what I have seen is the variety of demography of the patient versus the variety of demography of the service providers. Like a person coming from a very simple life is giving service to a celebrity, and a person like a doctor, a celebrated doctor, giving service to a, maybe a street kid. So this assimilation of this and crisscross of these services makes it very challenging in a healthcare or a hospital delivery kind of a thing. More importantly, what happens is an inpatient, when they come into a hospital, they go through average 25 touch points, right from the security guard to nursing to the person who is serving food, housekeeping, nurses, doctors, technicians, so on and so forth. To make them speak a very common language and get as per the expectation of the patient is the biggest challenge. That don't you think that that is a challenge that you all face in your industry, especially Dr.
Absolutely. I think the patient expectation is very important. And knowing your population and understanding what's the expectation. What's important is that you want to apply a standard. And this is why we push on quality of care. Because really you want to standardize the care as much as possible. So whatever the background of the person, you have a minimum that you're not going to provide less than that. After that, whatever the class of that patient, if a VIB or a royal member or whatever, then they have a different expectation, and we actually provide different services. But we have the general standard that we provide to everybody. I think a patient expectation is very important, understanding and studying your community and knowing your market very well, because otherwise you will not be able to compete and stay and persist in any competitive market. The whole world is becoming very competitive. And having multiple healthcare facilities around you in the same city also make your task more challenging, because you really want to be unique, you want to give something different from the others, and you want the patients, who's your clients, to come to you rather than going to other institutions. So yes, it is, and knowing the community is very important.
Thank you very much. Do you face similar kind of a challenge, and what do you do about it?
Yeah, first of all, very cool slides from you, and good to learn from you as well, because we see it very similar here, that you have to develop your personal. It's not longer the old way that somebody comes from university or from whatever, and then that's it. And you have this pyramid from CEO to and the patient or working people just on the bottom. Especially in dentistry, there is a lot of work what we do which is not life-saving or whatever. It's more a little bit luxury sometimes, and so we have to treat the patient as a customer, and the people who are working for us have to learn that it's not only medicine, but it's kind of luxury, and it's expensive and has to be paid by themselves and whatever. And the patient want to be treated like valuable customers. And they have to learn that they are a part of it, they are on the same height or whatever you name it, and that's a kind of a journey what is very interesting, but I think this is the only way for us to manage the future on a good way.
Thank you very much. Dr. Kenny, can you put some highlight on what you are doing to tackle this kind of situation?
Yeah, so I do agree with all the panelists. I think it's very challenging, especially you're facing a very competitive environment. Healthcare is actually an industry. By the end of the day, a business owner will want performance to be reflected in whatever investment they do. So this is what I face every day. So as what you said, when you are at the international level, when you're in Dubai, for example, like Dr. Mohammad faced, you have manpower from different demographic background. And when you are facing your customer, which is the local demographic, they are actually have a different background. You basically focus on your local community, which most of the time is 70% of your market, even though we are talking about international markets. But it will be the bread and butter. So we still need to require to understand what is the local culture. To add on to some information on how, because in our local setting, we do not, the Ministry of Health do not open doors for foreign nurses to come into Malaysia. They still required Malaysia to use their own nurses. That's why we still have restriction, because we have competition from everywhere. So, but if I do have this kind of environment or challenges, what I will do is we need to do a developmental review, a training in terms of culture, so that they will reduce the gap. Normally what we do is we will engage every person individually and do assessment and understand their competency gap. And after that, we will do an assimilation in terms of internal training so that they will understand fully what is Dubai's culture. For example, when do you establish, who is your president, came from which area, what is the main sensitive culture that we do not want to touch on. So that they understood that these are customers before they learn from the best way of learning is to learn from mistake. And when you learn from mistake, you're going to have a price to pay. So we do not want to go to there. So I believe maybe training and development, as what we said, is something that we need to practice into this organization. That's why I very respect that Health 2.0 actually combine education together with here. I met a few of the trainers from the other side, and they are very interested in collaborating for developing your organization culture, because sometimes healthcare professional worker, like I'm a doctor, I might not be knowing how to train a person effectively, because the way of being a doctor is we need to be very perfectionist in terms of helping to treat a patient to be more goal-orientated, because the margin of error was so low. But when you are doing training, it's very different. You need to have a very innovative mindset. You need to think out of the box, see how we are going to ensure that more anticipation, more sense of belonging, that, okay, I'm going to do this, I'm going to learn the culture, what is my next step of developmental milestone? Maybe I understand that if I'm a Filipino, if I come here, I understand that, oh, maybe the Abu Dhabi or the Dubai's culture is going to help me in my next stage of career. I can actually develop a business here, and I can maybe develop a nursing home that is more useful. I become an agency owner, and we understand the importance, and you give them the career pathway that they would like to anticipate and inspire more to go towards your pathway and your organization lead and your core value. If I were in that shoe, I might do that.
Thank you very much. What we do in India is we have started another department, which is bridging between the operations as well as the human resources and the marketing department, which is called Service Excellence. Now this department's role is to understand, because our service is patient-centric. We need to satisfy the patients ultimately. And how we are going to satisfy the patient is through the workforce. Now, what we do through Service Excellence is we understand the patient's pain points through there are various methods to understand, through the feedback, through direct communication, and then accordingly train the different departments, because different departments needs to be trained in a very different way to deliver their services. So we train the different departments in a different way to make them align as per the expectation of the patients. So that's how we do, and if anybody wants to know more about it, my contact information is there in the magazine, and I can give you more understanding how we do it. You know, my last question to the panel is, how much of technology do you use in HR, you know, to overcome your challenges?
Well, I think talking about the artificial intelligence and talking about technology, I think we have to understand that this is something that we have to use but not abuse, which is very important.
Absolutely.
This is something that we have to be smart about using it, and we made it, and we should continue to make it and develop it to serve us better and serve our patients. So this is very important. I always say we should not be the enemy of ourselves, where we say, no, we're not bringing AI because this is going to replace human. It will not replace human, and we have to use it. I think automation in a hospital is essential, and automation at all levels is essential, including HR, including everywhere. So automation and trying to avoid human error as much as possible. I think one of the advantages, and that's proven in the literature, that automation reduces human error. And one of the leading causes of death in hospital is human error. So really what we need to push for more automation, more process within the HR to start with, and having the process where I've been actually involved with companies where they even conduct some interviews using artificial intelligence analysis. If this is the right candidate for you, give you some parameters and give you a summary. This is the good person. Is he telling the truth or he's lying based on certain analysis, which was very interesting to see. Anyhow, that's at the HR level. In addition, that all system has to be automated. You cannot waste the time of an employee to go to an HR or look or apply for something. It has to be done all through an application or an automation. We're in 2023, you have to move on. And that's, of course, very important because this reduces the waste that the employee or the time that wasted, and give him more time to focus. Having the online courses and having the online training is something that the hospital should provide to their workers, which is very important. I think we may actually sometimes take too much care of our doctors and provide more CME to the doctors where we're not really giving a lot of attention to the others. I think we should focus on having online courses for our nurses, for our allied health, for our admins, who we want to develop, for our finance workers as well, because this is all science, and science, they have to be updated, they have to be always up to date with what's new. And I think that's where we should be using technology to optimize our services.
Thank you so much.
I can underline this, what you said. The use of technology is important, but it's not the only thing. At the end, it's a people business, what we're doing. And nobody from us or from you wants to see another doctor every time when you come back to the office. You're used to a specific doctor, or you're building a relationship with your doctor, except in emergency cases, for example. But you can change the doctor every time. Otherwise, you would lose the patient in our clinic. And the second is what we see right now. We have the first experience with online consultancies. For example, in dermatology, you send in a picture and get a diagnosis within 24 hours. That's nice as a first result, but it doesn't replace the visit to a doctor and the personal treatment and the personal relationship. And that's what we saying to our employees every time. Be kind, treat the people as you want to be treated, and think about that everybody has the right to get your time and the best result of it. And AI, for example, or digitalization, whatever, can help to get this, but at the end, it's your personal knowledge, what helps the people.
Thank you.
Thank
Dr.
you.
Ken.
So first of all, I agree with Dr. Mohammad saying that training in online platform is very important. That's actually under human resource development. That's the reason why Zoom, the share value increased so fast during the COVID period, because a lot of online conversation platform and training become normalized through online. Especially conference, we can see a lot of conference online. So another aspect of the benefit of technology in terms of human resource is, if you do realize that human nature of work actually change. And one of the things that we adopt in technology is we use an application for human resource management. I'll give you an example, my marketing and sales department. A conventional way of doing this is actually giving them a task. Every day you just carry out your job description, go out to meet your clients, come back. And you need to come in, punch in at 8 o'clock, you punch out at 5 o'clock. So the difference that we do is we created a performance-orientated goal, and we never restrict them what time you want to come in, what time you want to go out, but you are required to update your application, your human resource management application, which is, for example, Monday.com. These are called task-orientated apps that actually helps you to identify what are your performance at this stage. So a management or a leader, you don't need to go down to the ground and see whether or not they are actually doing their job, but actually they are going to do their job at their own will and direction based on their time that is more feasible. Because some of them may have COVID parents that are actually sick, or they might have long COVID patients that actually have these kind of complications. I cannot be able to restrict them to come in 8 to 5 and saying that they are not doing their job, but they are actually talented professionals. So we just need to give them a bit of freedom of time, but a certain guideline to tell management that things are on the way. And when you show your percentage is actually going on top of the hill, you know that your whole team are actually propelling forward towards your goal. So that's one of the things that I leverage on technology during the past 2 years by using performance-orientated automation gears or softwares. For example, Monday.com, they actually have automation system where email comes in, for example, sales emails, they will directly go out towards certain direction or protocol that you actually put into it. So automation system has been incorporated into IT that actually fasten the process in terms of sales and also engagement. So it might be more suitable in terms of non-clinical component, but we are still exploring a possibility of clinical component on how to make their job much better, such as what Dr. Mohammad said, automation in terms of procedures. I do discover that, for example, a very simple procedure we are doing, phlebotomy. I think developed countries, they are not using human-orientated to do phlebotomy anymore. They were using machines that will identify the vein location, using AI to recognize where is the vein, and straight away, with high precision, get the blood. In Malaysia, we still do not have FDA to go through it, but we are trying to explore, because you can see a lot of jobs that are, these are called labored jobs, that not necessarily required for human or healthcare worker to do to increase their burden, their stress level. We wanted to give them a much better quality of life by leveraging in advancement of technology. So I think that's from my part. Thank you, Prashun.
Thank you very much. Now we are open for questions. We have got 6.5 more minutes for questions from the audience. Please.
Thank you very much for this very interesting discussion. I was thinking of coming from this, for this conference, and no one was talking about nursing. I'm a nursing leader for almost 20 years now, and I really appreciate this talk today. I would like to highlight something also during this time, why the world is facing shortage of nurses especially. The Western countries, especially US, they are introducing magnet programs. If you see magnet programs, magnet is credentialed by the American Nursing Credentialing Association. It is specified gold standard for nurses, okay, where JCI and Sibahi or other Seha or whatever it is are doing for hospitals and patients, magnet is doing for nurses. So when nurses hear this, they go to the magnet hospitals. Why? Because they get better things there. I would just like to highlight something. Structural empowerment and transformational leadership is what we need in retaining nurses. Today, in today's world, there's about 50% worldwide nurses facing bullying, incivility at workplace, where nobody is addressing that. Out of the 50%, almost 80% of them do not report this thing. Why? Because of fear. Why? Because they do not want to have lateral violences from their peers. So I think advocating people on culture of civility, blame culture will be another mark to increase the retention of nurses worldwide. Thank you.
Thank you very much. Thank you. Anybody else?
Good morning, gentlemen. Thank you so much. Very interesting. My name is David Golding. I'm an addiction specialist. I wanted to seek the opinion of the panel, please, on the transient nature of the workforce and the impact of that on healthcare providers. Dr. Kenny mentioned the word career. Now, I'm old enough that I remember when I started work that you could imagine having a career at one company. Now, clearly, that's not the case now, and things are moving on. And I just wanted to understand the impact of the transient nature of the workforce to what you're trying to do. Thank you.
Can you address it?
Okay. So transmigration of workforce, I think is a very big issue for a lot of healthcare providers. Basically, it's just a means of competition, and it's where a very simple mindset where a lot of Malaysian doctors, like a lot of a lot of Malaysian nurses, a lot of Philippine nurses, they are migrating towards either Singapore or towards Dubai or towards European countries. The reason is because it's actually at the upper hand in terms of competition, because if you look the whole market in the whole globe, the whole world are developing in terms of healthcare, and healthcare is an industry. So when you provide a much better offer, people will just jump over. Now the question is it a good thing or is it a threat when you do a risk assessment? To us as a healthcare provider or as an organization, we just need to embrace it, because this is part of our life. When you offer someone a much better environment, you cannot stop your juniors or your co-workers from leaving, because it's actually for their future. So when we do a developmental career review, we never restrict a person that you need to be within our organization for me to give you an input on what career pathway you should do. However, we tell them that if you go this way, you can have this kind of opportunity in this country, for example, in that country. By the end of the day, the challenges is to how to overcome this kind of opportunity for our talented staff and give them a sense of belonging to stay with your own organization. That's why what we mentioned just now, restructuring and changing their reward system and identifying their challenges in their life will be a significant point, because sometimes what they want, a lot of the healthcare worker might just want to stay within their own culture where they are more familiar with it. So that will be on the upper hand. By the end of the day, if you have healthcare workers that would like to migrate into a better, greener pastures, we should encourage them to go on.
Thank you.
Just to follow up on the comment about the nursing director, I really enjoyed your comment. Thank you very much. I think very important that we build culture. And it's important that we have programs where we attract employee like the magnet program or whatever, but the most important is that leadership has to do their role by building the cultures. And the values that we always embrace, which is the diversity and empowering our worker, that's very important. If they see leadership empowering them, they will not get abused, they will not get bullied, because they will know that the leadership is supporting to them. So I hate sitting in the office as much as I have to sit in the office, but I hate sitting in the office. I like to be down on the field looking at people and talking to them. And that's where nursing directors has to be. In my opinion, nursing director has to be down, talking, empowering, encouraging, and leading by an example. So all people build that culture that you want to build. Thank you for the comment.
Last question, please.
Thank you. So I'm a doctor from the UK. In the UK, we have the NHS, which is in the middle of a major crisis at the moment, a workforce crisis.
Can you speak a little louder because
Sorry, excuse me.
we
Yeah,
are
sorry.
unable to hear.
So we're in the middle of a workforce crisis in the UK. We see that junior doctors are striking for pay parity. They've lost relative to other professional groups over many years. We see that the consultants are probably going to strike very soon as well. We've lost a lot of senior doctors because of cultural problems within the NHS. We've lost a lot of senior doctors because of issues around pensions. And we see that of the people in medical school, 30% do not intend to take up a medical career. So how would you suggest that we tackle these problems?
Can you take it up?
Yeah, if I would know the answer, I would be happy. But this is the same what we see. We see that many of the new medical doctors, whatever, are going to anywhere, but not in the medical industry, not in the health industry itself. And I think this is one of our challenges, and I think this is worldwide the same, that we have to make this profession, and doesn't matter if you're a doctor or a nurse or whatever, more attractive. And this is, I think I would use the word respect for everybody who's working there, and that you feel respect. And that what you told, that is at least as important as the view on the doctors, is the view on the nurses and all the assistant professionals here in our industry, because it wouldn't work otherwise. And we have to see these problems in the future, because it will, I think, getting more and more. But we have to look for solutions. And I have no idea for as an let's say absolute solution how could we manage it, but we are working on it, and we do look for several attractive, let's say, solutions to make to keep these people in the health industry and not to lose them to anybody else.
Thank you very much.
Thank you.
You have to
very
edit the
much.
video.
Yeah, I just want to add on something. I do agree
quickly.
that it's actually culture-driven and leadership to change the culture for a sense of belonging, listening to the ground level. But to look into a bigger perspective, you can do an evaluation to compare the healthcare system in UK and other countries. Because by the end of the day, you can see why a lot of striking happens, because the timely response towards their concern is not there. And why the timely response is not there? Because you are dealing with the whole perspective of healthcare as a role. Instead, if you compare towards a private medical center, they involve in performance-driven, and if you have a strike, it's going to cost you a lot of dollars and cents. So when you are in a private organization and you have a strike, your CEO will go down to the ground and deal with the issue personally. But if you're in a big organization, in like Malaysia, you have a two-tier system. If you have a strike, I don't see my head of directors of the state health come to the ground and settle the issue. It won't come to that level, because it's about the concern and prioritizing whether or not this strike is important towards your future. So maybe you can look into the structural changes, but it's going to be a lot of reformation, a lot of debates.
Thank you very much.
Thank you very
Thanks.
much, gentlemen. This was a fantastic discussion on
Thank
the
you.
challenges faced by the human resources team within the healthcare industry. And Miss, thank you very much for bringing up the issue that nurses face with the blame culture and the lack of civility. I believe it's a global problem.
Thank you,
Thank
sir.
you. Thank you very much, gentlemen. Moving